Hi, I'm Deborah Toll.
And I'm Matt Donahue, and we're two of the physical therapists on the Run Fit team here at Marshbrook Rehab. We specialize in evaluating and assessing running athletes and their injuries. We also do run analysis, run video analysis, and we're going to be providing several short clips over the next year or so to provide runners with information about different injuries that they may encounter.
So recently I've seen a couple of patients who came in with a diagnosis of hamstring strain, but turns out they had pain that was actually in the back of their leg referred from their low back. So we're going to kind of do a little quick differential diagnosis of when you have symptoms in the back of your leg. What are the potential diagnoses, and how might you figure out which one you have? So first one is a hamstring strain. So Maddie?
So with the hamstring strain, the hamstring area is the muscle that crosses from the back of the hip just to below the knee. And when we have a hamstring strain, typically it should respond to typical management techniques of a muscle strain after a couple weeks. When we talk about the signs or symptoms you might be feeling with a hamstring strain, anytime we actively use that muscle or contract it, it should cause pain. And if it gets put on stretch, it should also cause pain. But again, it should respond to rest, avoiding the offending activity that hurts it. And if it doesn't, then that's when you may have to get differentiation. Is it coming from somewhere else? For runners, typical causes of hamstring strain can come from a couple of different reasons. Two of the primary ones that we'll see here in clinic will be decreased strength in the glutes and the backside of your hip, because the hamstrings take on an extra load and they're not made to do that. And the other instance is during running, if we're overstriding, getting that foot upon contact way in front of our body, that hamstring has to work really hard to get the body over the foot. So that's where traditional hamstring strain is a really likely diagnosis, but if it's not getting better, then it may be coming from another spot, Deb. Where would that be?
Well, that would be your low back. So the lower lumbar spine refers pain into the posterior thigh. So you can see it's pretty much in the same area that the hamstrings are. You can have pain in the back of your thigh coming from the low back and not have low back pain at all. So that's not necessarily a diagnostic itself. People that get this tend to be people who are sedentary a lot of the day. Say you sit at a desk for 8 hours a day at your job, or people who do a lot more heavy activity, say bending, lifting, twisting at work throughout the day. Those are the kind of things that put a load on your spine, can pinch a nerve and give you symptoms down into the back of your leg. As Matt said, when you have a hamstring strain, you feel, or any kind of muscle strain, you feel that when you either stretch the muscle or contract the muscle. With a low back referred pain, often you feel it more in sitting, again, because you have a load on your spine and because of the position of your spine. You also might feel it when you're running, and in that case, it's more because you're putting an extra impact or load on your lumbar spine. So it can kind of present similarly, same kinds of symptoms. Getting it when you're running, so that doesn't really tell you which one it is. But as Matt said, if it doesn't respond to conservative care, you might consider that it might be coming from your low back. So how do you figure out which one it is? Well,
come see a physical therapist.
Yeah, if it doesn't respond as you would expect it to, then come see us and we'll do a pretty thorough differential diagnosis and figure out which one it is, because the treatments for them are really quite different.
All right, thanks.